Why popping pimples near your nose can kill you. Doctors have long warned against popping pimples, especially those located near your nose and upper lip, because of what they call the danger triangle or triangle of death. The reason behind this name is that popping a pimple in this area could potentially be fatal. And this is due to the fact that there are some major veins around that region of the face that could carry bacteria from your skin directly into your bloodstream and all the way to your brain. So today we're going to talk about why popping pimples in the triangle of death could kill you, how this actually happens, and how to avoid it so that you do and end up with a deadly infection. So, if you want to know more about the triangle of death and how to avoid it, stay until the end of this video where I will tell you everything you need to know. But before we continue, if you appreciate all the information and the research that goes into making a video like this, it does help out tremendously if you hit the like button or hit subscribe. Thank you, and let's begin. So, the triangle of death is an area on the face that includes the nose, the mouth, and the upper lip. Now, it is important to understand that while popping pimples anywhere on the body could lead to some degree of infection, popping pimples within the danger zone has much higher risk of causing severe complications because of its proximity to the blood vessels that drain directly into the cavernous sinuses, which are the venous channels that drain directly into the brain. And this makes it much easier for bacteria to enter the bloodstream and travel straight to the meninges, leading to a deadly infection called meningitis. But to understand how dangerous it really is, we must first learn about acne and how it gets infected in the first place. So pimples or acne form when hair follicles become clogged with dead skin cells and sebum, which is the oily substance produced by your skin. When this happens, bacteria can enter the clogged pores and cause an infection. This is usually caused by a type of bacteria known as Propionibacterium acnes, or more commonly, Staphylococcus aureus, which is a bacteria that lives on the skin and in the nose. Once inside the pores, the bacteria multiply and cause inflammation, which results in the formation of pimples or acne. And while most pimples are harmless and go away on their own, some can become infected. This typically happens when someone touches their face with unwashed hands and bacteria from the environment gets transferred to the skin. Or if a person picks or squeezes a pimple, they can introduce bacteria from the surface of their skin into the pores. This can lead to a bacterial infection that causes the pimple to become red, swollen, and painful. In most cases, infected pimples are not serious and can be treated with antibiotics. However, if left untreated, they can cause complications such as abscesses, cellulitis, and sepsis. Cellulitis is a bacterial skin infection that can spread to the underlying tissues. If a pimple becomes a furuncle or a boil, it means that the infection has spread to the hair follicle and the surrounding skin. A boil is a painful, pus-filled lump that can develop into a more serious infection if left untreated. Sepsis occurs when the body's response to an infection damages its own tissues and organs. It can cause organ failure and shock, which can be life-threatening. Now, while these complications can occur when popping any pimple, the risk is much higher when dealing with those located in the triangle of death. And this is due to the facial veins in this area, which are connected directly to the dural venous sinuses. These veins play an essential role in draining blood from the face and the forehead and then returning it to the heart. The problem arises when the skin around these veins becomes infected. The bacteria can then travel through the veins and reach the dura, which is the protective membrane that covers the brain and the spinal cord. Once inside the dura, the bacteria can cause an infection called meningitis. Meningitis is a serious inflammation of the meninges that can be caused by viruses, bacteria, or other microorganisms. Viral meningitis is usually less severe than bacterial meningitis, but both can be very dangerous. Symptoms of meningitis include fever, headache, stiff neck, nausea, vomiting, and sensitivity to light. In severe cases, meningitis can cause brain damage, hearing loss, or even death. But even though this sounds terrifying, it is important to keep in mind that the risk of developing meningitis from popping a pimple is still relatively low. According to the Cleveland Clinic, most people who pop pimples do not develop any serious complications. However, there have been rare cases of people developing meningitis after popping a pimple in the triangle of death. One case was reported in 2007 where a 20-year-old woman developed meningitis after popping a pimple near her nose. Another case was reported in 2013 where a 32-year-old man developed meningitis after squeezing a pimple on his upper lip. Fortunately, both of these individuals recovered after treatment with antibiotics. But this highlights the fact that popping pimples in the triangle of death could have serious consequences in rare cases. So how exactly does this happen? Well, when a pimple is popped, the bacteria inside the pimple can enter the skin and travel through the blood vessels to the brain. The blood vessels in the triangle of death are particularly dangerous because they drain directly into the cavernous sinuses, which are large veins that pass through the dura, the protective membrane that covers the brain. If the bacteria reach the dura, they can cause an infection called meningitis. Meningitis is a serious condition that can cause inflammation and swelling of the meninges, which can lead to brain damage, hearing loss, or even death. The most common symptoms of meningitis include a high fever, severe headache, stiff neck, nausea, vomiting, and sensitivity to light. The bacteria responsible for the infection can be passed from person to person through respiratory droplets, which are released when an infected person coughs or sneezes. Once inside the body, the bacteria can multiply rapidly and spread to the meninges. Meningitis can be difficult to diagnose because its symptoms can mimic other conditions such as a bad headache or the flu. Treatment for meningitis typically involves a course of antibiotics, bed rest, and plenty of fluids. In severe cases, hospitalization may be necessary to monitor the infection and provide intravenous antibiotics. It's important to seek medical attention right away if you suspect you have meningitis, as early treatment can prevent complications and improve the outcome. Now, while popping pimples in the triangle of death is rare, there are some things you can do to reduce the risk of infection. First, always wash your hands thoroughly before touching your face. Use a mild cleanser and warm water and dry your hands completely before touching any pimples. Avoid sharing personal care items such as towels or razors with others, as this can spread bacteria. Also, if you do pop a pimple and it becomes red, swollen, or painful, see a healthcare professional promptly. They may prescribe antibiotics to prevent a more serious infection. Remember, while popping pimples may seem like a quick fix, it's important to take care of your skin and prevent infections. By following these simple tips, you can reduce the risk of developing a serious infection and keep your skin healthy. So, in conclusion, popping pimples in the triangle of death is a dangerous practice that can lead to serious complications such as meningitis. While it may seem like a harmless activity, it is important to remember that the area around the nose and upper lip contains blood vessels that can carry bacteria directly to the brain. If left untreated, this can cause inflammation and swelling of the meninges, leading to brain damage, hearing loss, or even death. To reduce the risk of infection, it's important to wash your hands thoroughly before touching your face, avoid sharing personal care items, and seek medical attention if a pimple becomes red, swollen, or painful after being popped. Thank you for watching. If you found this video informative, please leave a comment below and let me know what other topics you would like me to cover in future videos. Also, if you haven't already, please hit the subscribe button so you never miss any of my new videos. Thank you again for watching, and I look forward to seeing you in my next video. Goodbye.